The good news is, though, that as opposed to patients who have a malignancy like leukemia who develop PML, you can reverse the effects of Tysabri. And in fact, patients who develop PML, not all of them will, with Tysabri, not all of them will go on to death. It can be stopped. And this, which I'm sure you agree is good news, but basically this is what happens is we can use plasma exchange, which is basically like putting people on dialysis. So you just wash it out of the system, okay? And if you take this level here is the actual natalizumab level. So if you just let it stop the infusion here, the final infusion, your level of natalizumab will gradually decline over these days, okay? And that's what would happen. You'd get to sort of 21 days and then you'd come up for your next infusion to top up your level then. But of course, what's happening during that time, that level's high, you're blocking the lymphocytes getting into the brain to wash out the JC virus. And this is what the adhesion, these are all representing adhesion binding. So what you can do is by doing these plasma exchange, you wash out the level each time, so you gradually decline the level there. So in fact, you've almost got it out of your blood and hopefully allowing immune surveillance to recur again. So what do we know about PML? Well, as I've suggested, so far it looks like the duration of exposure is about 25 months before your risk is really at its highest. Presenting symptoms are these subtle ones initially of cognition and then motor performance later on. Seizures and unexplained pyrexia seem to be characteristic to PML with natalizumab. One of the ways of detecting it is MRI, but the other is also to do lumbar punctures to look for the JC virus. And we have to watch out though, because that lumbar puncture test isn't always reliable. And some of the patients with PML, it's taken up to 3 lumbar punctures to actually find the JC virus. It also has been shown that in the patients who we were able to look back on their seropositivity for JC virus, those who developed PML were always seropositive at the beginning before they received Tysabri. Some gadolinium enhancement is present on the MRI, so the MRI is very difficult to distinguish sometimes between an MS MRI and a PML MRI. But it can be treated, this PML, with plasma exchange. We also see exacerbation of symptoms after the plasma exchange. There are some treatments. Unfortunately, there have been some deaths, but certainly not all people are dying from this PML, just 25%. But some are being left with significant disability. Professor Giovannone is leading action on this, particularly in the UK, and he's developed this algorithm which has, I believe, really gained acceptance amongst the neurological community. And this is how we're going to try and really manage PML and Tysabri for now. So, we have natalizumab therapy. What we suggest is you have baseline profiling. The most important one of this is really your JC virus. If you had JC virus as a child, you'll probably be seropositive, and it will mean you'll have JC virus sitting in your body somewhere, certainly bone marrow, kidneys. Now, if you're negative, it means you haven't had that JC virus, so you're very low risk. And we'll just monitor your JC virus serology. If that turns positive, then we'll have to switch you over to this arm, which is if you're JC virus positive, then you're at higher risk of PML. And therefore, we have to have a very high clinical suspicion if you develop in PML. And that would involve assessments, as you do have already when you come for your infusions. You have a yearly MRI. If you have any suspicious lesions or clinical features suspicious of PML, we'll probably have to suspend the Tysabri, do lumbar punctures for JC virus, and also think about other opportunistic infections at the same time. If you reach 2 years of natalizumab therapy, we may consider drug holiday, and I think this is something we would have to discuss with individual patients about the pros and cons and the feelings about how people are about continuing the risk, and I think this information will change over time. And then during this holiday we may have to consider steroids or such like to stop reactivation of the MS or other therapies, and we'll monitor that with MRI activity. Okay, and that's it. Thanks very much.